let's talk ESG-MAX. So this is a combination procedure, which is combining the endoscopic sleeve gastroplasty, which is the ESG, with the gastric fundus mucosal ablation, which is a procedure that we've developed here. And we're combining the two to create this new procedure. So we're going to talk a lot about that. To begin with, though, I want to just lay the foundation, which is ESG. What's endoscopic sleeve gastroplasty? If you're not familiar with it, very, very brief description. We are endoscopically, meaning down through the mouth with a scope, taking the normal stomach and reducing the size into a sleeve, all from within. I want to point out some anatomic landmarks, actually one in particular. The very top of the stomach is called the fundus. We'll be talking a lot about that tonight. But this is the general shape change that we're achieving with an ESG. Here's what it looks like. This is our endoscope with a suturing device, which attaches to the end. We drive our scope down into the stomach and then suture it from the left wall to the right wall. So we're narrowing down the stomach. These sutures are then pulled tight, and you can see the stomach getting more narrow into a tubular kind of banana-like shape. So that is a 70 to 80% reduction in stomach size. That is the ESG procedure. It's what we specialize in here at TrueU. We've treated many thousands of patients over the years. It's a really good procedure. And in fact, it's clinically proven. So this is FDA approved for adults with a BMI of 30 to 50. We know it's really safe. We know that it's durable. It provides long-term weight loss of at least 3 to 5 years or more. And the average weight loss is about 17% of body weight, which is a significant number. And as such, it is the most effective non-surgical weight loss procedure. However, it's not as effective as surgery. So we know that a surgical sleeve is a little bit more effective in terms of weight loss. And one of the reasons that the ESG is less effective for weight is it's less drastic. We aren't cutting away stomach, stapling off stomach, just less drastic. But most importantly, we're retaining the gastric fundus. We're not cutting it out. And that has several major impacts. Now, this is actually what the ESG, a patient's stomach looks like about a year or more after an ESG. This is a X-ray test, a contrast test. The white color is liquid contrast that the patient drank. And you can see this really nice narrow sleeve from the ESG, but the fundus still up here, serving kind of as a reservoir. And that's really the design of the ESG. We do this intentionally, but it is one of the downsides and limitations because of that fundus. And the fundus is a key regulator of appetite. So primarily, we know that ghrelin, which is the hunger hormone, is produced within the lining of the fundus. And also the fundus stretches as we eat. And so that accommodation to food closely regulates appetite and fullness. And so if we look at this ghrelin hormone specifically, it comes from the fundus, from that top of the stomach. When we eat, it kind of calms down. And then after we eat, the stomach empties out. And what happens? Ghrelin levels start rising. So this ghrelin hormone is circulating through the body to the brain and increasing, and we become hungrier. And that can lead to weight loss stalls. It can lead to weight gain. So it's a very powerful hormone. Until now, the only way to reduce that was to surgically remove that part of the stomach. But we asked, could we endoscopically reduce ghrelin and that accommodation? And this is something that we've discussed previously. The answer is yes. We've proven this through some of our earlier studies, and that is via mucosal ablation. So instead of cutting away the stomach, we're ablating, we're treating with heat to address this area. And this is what it looks like. So we're passing an endoscope again down into the stomach, up to the top of the stomach, which is the fundus. And then we're first instilling a saline fluid cushion to separate that inner mucosal layer from the deeper stomach tissues. And then we're applying thermal energy or heat to completely ablate this part of the stomach. So complete ablation of the gastric fundus. This is what it looks like immediately after the procedure. That wide territory is the entire fundus as it's ablated. And somewhat magically, within a few months, you see the complete healing of the fundus. And so this really large area has reduced in size to this very small area. And so what we've achieved is two key things. So the first benefit is a lot less ghrelin because of the procedure. That leads to lower hunger and cravings and reduced weight. Secondly, we see that the fundus shrinks. So this isn't just about ghrelin. We're seeing shrinkage of the fundus. It's tighter, it has less capacity. And so when you compare it to a normal stomach, just with the fundus ablation, we have reduction in capacity. It cannot expand to the same degree. So those are the two key benefits of just the fundus ablation. Now, we've studied this, we've presented this at prior webinars and nationally, and we've now published our results, which are to be released in the journal Gastroenterology. What we know is that the fundus ablation leads to a very significant reduction in ghrelin in the blood, ghrelin cells, stomach capacity, and ultimately hunger, appetite, and cravings. Okay, so we talked about ESG. I talked about fundus ablation. What happens when we combine both of those? And so that is the ESG-MAX. And so what we're doing here is taking that fundus ablation and combining it with the sleeve, with an ESG, all endoscopic. And what we're getting is the benefit of a sleeve procedure, plus the prolonged reduction in hunger, plus the reduced fundus capacity. And so all of this is still, though, a single same-day non-surgical procedure. So we're really maximizing fullness, maximizing the reduction in hunger, maximizing results via this ESG-MAX. So let's talk about how we're maximizing results. I'm going to hand off to Dr. Maselli, who is going to dive into some of the data.
Thanks, Dr. McGowan. So that's right. That seems like a great procedure in concept. How does it actually perform? So let's dive into the data. We'll start with weight loss. Of course, that's on all of our minds. So if we look at standard ESG based on a really special type of publication called a meta-analysis. The meta-analysis takes basically all available data up to the date of publication and gives us a really good overview of what happens. And what we look at, what we can learn from meta-analyses of ESG is what you see in front of you here with this weight loss trajectory. Over the course of about a year, ESG achieves a weight loss on average of about 16.5%. That's pretty consistent across various different meta-analyses. So how does the ESG-MAX perform? Well, based on the available data that we now have at TrueU Weight Loss, the curve looks a little bit like this. So clearly, and now I have to give a caveat here, this is not a direct head-to-head comparison between ESG and ESG-MAX in the same study, but with that caveat aside, what you can clearly see here is the trajectory of weight loss from ESG really outperforms standard ESG. Now, there's two additional things that I'd like to draw our attention to in this graph. The first is appreciate the slope of that weight loss curve. It actually is really similar to the ESG slope. It's gentle, it's safe. We don't get this rapid, unsafe degree of weight loss right away from the ESG-MAX. And that helps protect patients from things like muscle loss, hair thinning, malnutrition, loose skin. So this is a safe, gentle slope of weight loss. The second thing I'd like to point out is weight loss isn't the only outcome of interest here, right? There are a lot of reasons patients might seek weight loss, including the downstream benefits, like improvement in the over 200 weight-related medical conditions like high blood pressure, high cholesterol, sleep apnea, type 2 diabetes, PCOS. There's, again, over 200 of these. And these tend to improve at various increments of weight loss and really tend to improve or reverse completely once a patient has achieved a weight loss of about 10 to 15% of their body weight. And as you can see from ESG-MAX, this happens sooner along their weight loss trajectory. So our patients who are undergoing ESG-MAX are really achieving that benefit to their health at an earlier time period. And this is really valuable data for patients, like many of our patients who are seeking to improve those health conditions and really get off the medications that are used to treat those conditions. All right, so how does the ESG-MAX stack up against available weight loss treatments that are out there? Well, if you look at the very left side of this graph, you'll see diet and exercise, and then you'll see a variety of treatments that we offer at our bariatric endoscopy practice, things like intragastric balloons and the standard ESG, as well as weight loss medications like semaglutide. And as you can see here, again, this is not a head-to-head comparison from a trial, but it gives you the general sense that ESG-MAX is really outperforming these treatment options in terms of absolute weight loss at a year. And if you look towards the right side of this graphic, you'll see that it's really starting to approach bariatric surgical levels of weight loss, never before seen with an endoscopic weight loss tool. Now, we're obesity medicine physicians, so we know that weight loss is not the only reason that a patient might pursue a particular therapy. And we're here to help triangulate between a patient's personal goals and their medical needs and their disposition towards risk. So how does risk work out with ESG-MAX? Well, turns out pretty well. So you can see here that ESG-MAX is not only a great tool for losing weight, but it's also a great tool for losing weight safely. You can see that it's very safe compared to the more invasive bariatric surgeries and is quite safe even compared to other endoscopic weight loss tools, particularly when performed at centers with expertise. So let's look at what some complications or adverse events that can arise from the ESG-MAX procedure. So at the heart of it, as Dr. McGowan reviewed, this is an ESG. So ESG-MAX is slated to have the same risks as a standard ESG. So what might those entail? Well, that could include bleeding into the stomach or infection around the stomach, tearing of the stomach lining, or a blood clot. And as you see from that third column there under risk, these risks are actually pretty rare, even rarer, again, at a center like TrueU that has expertise in these areas. They're also short-term. So if they were to occur, they would occur within a week or two of the procedure. There's really not long-term risks to an ESG. Now, are there any additional risks that the ESG-MAX would confer, beyond the standard ESG? We think in theory there's probably a slightly heightened risk of stomach ulcer. And of course, we say in theory because in the over 100 patients we've treated with ESG-MAX, we've yet to encounter a complication. But we think because of the fundus ablation that there's probably a little bit of mucosa that can get irritated to the point of an ulcer. So how do we address that? Well, we're going to use anti-ulcer medications, much in the same way we do for ESG, just for a little bit longer. We're going to ask patients to avoid medications that promote ulcer formation, like non-steroidal anti-inflammatory drugs like ibuprofen, much like we do with ESG, but just for a little bit longer. And we're also going to use really safe technique, like that installation of fluid that Dr. McGowan went over in the fundus ablation video. So I talked about a couple of sleeves, and I'd like to give kind of just a 30,000-foot view of the comparison of sleeves. If you're a patient who's interested in losing weight through a sleeve procedure, I thought this chart might be helpful. And of course, these three sleeves are the standard ESG, the ESG-MAX procedure, and then the surgical sleeve. And sometimes we'll call the surgical sleeve vertical sleeve gastrectomy or VSG. We mean the same thing. And what I'm trying to impart by comparing them in this way is that the ESG-MAX is a procedure that tries to get the best of both worlds, that borrows from ESG, the benefits of ESG, and borrows a bit from surgical sleeve. So what do I mean by that? Well, the ESG-MAX, like ESG, is an incisionless, meaning non-surgical procedure. It's performed entirely outpatient, and patients are able to get back to work in just a couple of days and have no physical activity restrictions beyond the dietary. Now, that's in contrast to a surgical sleeve, which is not incisionless. It's a surgery, and it's performed in the hospital, and patients will typically stay overnight in the hospital for a day or two. They have a little bit of a delayed return to work, and they do have physical activity restrictions on account of the incisions. However, much like a surgical sleeve, the ESG-MAX actually reduces ghrelin, which is not the case for a standard ESG. Not only is ghrelin unaffected, it actually might increase in standard ESG on account of weight loss. Ghrelin will increase in proportion to weight loss, and that's been shown in a publication of ESG. And finally, some of the concerns that patients might have about the surgical sleeve is the increased risk of new or worsening acid reflux, or the fact that they have to take lifelong supplementation of vitamins and minerals. But in this manner, ESG-MAX actually behaves more like the ESG, where you don't really see an increase in heartburn or acid reflux, and you do not need to be on lifelong supplementation of vitamins. So I'd just like to provide a little bit of feedback. And, Dr. McGowan, Dr. Donnangelo, and I, we have the pleasure of seeing our ESG-MAX patients in follow-up month after month, and have the opportunity to get this feedback from patients. And these are direct quotes that you have in front of you here. And what you'll see is they're really variations on a theme. ESG-MAX is a procedure that grants patients enhanced control over their cravings and appetite and hunger. And, it really does underscore just how cool of a procedure this is. Yes, endoscopic weight loss tools can help patients lose weight in really meaningful ways, but this is the first one to do so by directly targeting hormonal pathways of hunger. And I think that's pretty neat. So I'm going to turn it over to my partner, Dr. Donnangelo here, to walk us through, what an ESG-MAX patient would expect on procedure day and after.
All right. Thank you, Dr. Maselli. All right. So that's right. I'm going to walk you through kind of what's going to happen on your ESG-MAX procedure day and thereafter. So the procedure itself lasts about an hour and a half, so a little bit longer than the standard ESG. Of course, we've added on that ablation component. You will be under general anesthesia, meaning completely asleep with a breathing tube in place. Your procedure, of course, as we've mentioned already, is performed by a highly experienced team. Bariatric endoscopy is all that we do and all that our team does all day, every day. At the conclusion of your procedure, you will recover in our recovery bay for about 45 minutes. You'll be one-on-one with a nurse. You'll wake up from anesthesia, receive any additional intravenous medications for things like nausea and cramping that you might need. And then you actually go home, you're discharged the same day. So there is no overnight hospital stay or inpatient monitoring required. We do ask that all of our patients come back to the same clinic the next morning for what's called hydration clinic. So this is a quick 30 to 45 minute clinic visit where we check in on your symptoms. We give you any additional intravenous fluids and medications that you might need. We'll review your procedure report, and then we'll kind of chat and set expectations for the remainder of your recovery and your path going forward. And that's a picture of our lovely Atlanta office. As far as your follow-up going forward after hydration clinic, everything is virtual. So of course we give you this amazing weight loss tool, but your medical and nutritional follow-up, our aftercare program, is really unique and very critical to your long-term weight loss and your long-term weight maintenance and success. So we want you to be able to attend all of these visits. We make it easy. They're all virtual, and we have a lot of availability and a really great support team. So I'm kind of separated into two categories. You will have medical visits. Of course, that consists of your initial consultation. You'll be seen in hydration clinic, like I mentioned. You'll have a 1-week post-op, and then you'll be seen by a member of our medical team every 1 to 2 months for the first year after your procedure and as needed thereafter. That being said, this is a concierge medical practice, and so after your procedure, you'll have 24/7 access to your physician via cell phone. So we always encourage our patients to text and call if they ever have any questions, concerns, or they want to celebrate, a scale victory or a non-scale victory. So we really encourage that. As far as the registered dietitian component of the program, we have an amazing team of weight loss specializing registered dietitians. You will be paired with a registered dietitian prior to your procedure. You'll meet with them about a week or two prior to your procedure day in order to review your protein goals, your fluid goals, and make sure that you're well set up and prepared for your diet progression, which we'll talk about on the next slide. You'll meet with your, well, sorry. Thanks, Dr. McGowan. You'll meet with your dietitian about 3 weeks post-op. That's kind of when you're starting to transition your diet stages, 7 weeks post-op, and then again, very frequently through the first year after your procedure and as needed thereafter. Again, you're always welcome to email your dietitian at any time. We're always available to you. Go ahead. All right, some questions about nutrition. So we do get a lot of questions. What can I eat and drink beforehand and after? So before your ESG, again, your ESG-MAX, and I will mention too, our diet progression is the same for all of our procedures. The diet before the ESG and ESG-MAX is different from traditional bariatric surgery. You may have come across things like liver shrinking diets or prolonged, liquid phases. That's not required. You're on liquids 1 day prior to your procedure, and then nothing by mouth for about 12 hours overnight, just to make sure you're nice and cleared out. Post-procedure, we actually allow you to start sipping protein and fluids immediately. We want to get your nutrition back up. You don't have to hold off on that. And as far as nutrient recommendations, kind of the minimum average is around 60 to 90 grams of protein, but that's on a case-by-case basis. You'll work with your nutritionist, and 64 ounces of fluids a day to make sure you're hydrated. The diet progression, there's a little schematic there on the bottom. If you're curious as to what this looks like, it's about 7 weeks long. First 48 hours is clear liquids. First 2 weeks is full liquids, so things like milky protein shakes. Then finally purees for about a week, soft foods for about a week, and then regular food around week 7. All right. So I will bring us home with the last slide here. ESG-MAX at TrueU weight loss. So this is, a unique and special procedure at what we feel is a really unique and special practice because we are the highest volume center for ESG in the United States. As we've talked about, earlier in this webinar, we have pioneered fundus ablation. We studied it in the first in human clinical trial, Ablate Weight 1. And we published the results of our study in a major medical journal, Gastroenterology. We invented the ESG-MAX procedure and also studied it in a first-in-human clinical trial called Ablate Weight 2. And we are the only center, and this is important, we are the only center currently in the United States offering both fundus ablation and ESG-MAX, having performed more than 100 ESG-MAX procedures to date already. So we're really, really excited to offer this, and we think it's an amazing option for our patients and definitely a way that this field of bariatric endoscopy is going to be moving in the future. All right, so we'll bring it up for questions.
Thanks, Dr. D. And I think, importantly, we've treated a lot of patients with this technique now. So we have a really clear understanding, not just on the weight loss, but on all aspects, the recovery, how patients feel at month 1, 3, 6, 12, and really what that impact is on the entire individual. So we'll be really happy to talk through that. Keep in mind, Laura Sebring is here with us to talk nutrition, all questions nutrition related. She will tackle those. And there's a bunch of questions already in the Q&A, so I'm going to let Mary drive the show here, and we'll answer every question. So keep those coming, keep punching those in there. And if someone's raising their hand, instead of raising your hand, if you can just go ahead and put your question in the Q&A, we will get to that. Thank you.
All right. Thank you, Dr. McGowan. So I'll just rotate between questions. We have a lot already. I'll start with the first. We'll kind of jump between topics, but the first one we got is from Andre. He asked, can your stomach shrink naturally on its own? Like maybe if you try eating smaller portions for a long time, is that a possibility? And I'll start with Dr. McGowan.
Sure, I'll take that on. Yeah, that's a little bit of a myth, actually, that fasting will lead to stomach shrinkage of any significance. It really won't. Your stomach is designed to be stretchy. It's basically a stretchy bag, and you can't shrink it through any mechanism other than a surgery or procedure. Now, I think maybe a related topic would be, can the fundus that we've ablated stretch out over time? Not likely. One thing we showed in our studies is that area it becomes fibrotic, kind of stiff, the tissue changes, and it's almost like scar tissue in that lining. It really is very stiff and won't stretch. That's a good thing. That should lead to very long-term results.
Okay, thank you. Okay, Dr. Maselli. So I know Dr. McGowan talked about the fundus. Someone did ask, like, what happens to the ablated area of the fundus? So would patients have any pain or symptoms, and could it ever grow back?
Yeah. So we'll tackle, kind of those two parts separately in terms of what happens to the fundus and then symptoms. We'll start with symptoms. So the symptoms of the ESG-MAX procedure, so we're talking about the combination of, again, fundus ablation and ESG, are actually identical to those of standard ESG. And that's because fundus ablation doesn't really drive symptom burden too much. It's actually the ESG itself, the sutured sleeve. So this would be about 3 to 4 days of some upper GI symptoms, things like cramping, bloating, pressure, mild heartburn and nausea for like a day, but really it's cramping. Now, what happens to the fundus over time? Well, as Dr. McGowan alluded to, the end result of the ablation is replacement of some of that healthy tissue with fibrosis, with scar tissue. What are the steps over those first 8 or so weeks to get there? Well, the cells that we've ablated, or most of the cells that we've ablated, kind of slough off, they die off. They go through this inflammatory cascade of healing, and then are gradually replaced with that scar tissue, that fibrosis. So the healing that takes place does so over approximately 8 to 12 weeks, which is why you see a 7-week modified diet and why you have 12 weeks of medications to help that stomach heal, anti-ulcer medications during that time.
Thank you. We have a lot of questions coming in. Okay, Dr. Donnangelo, I'll go with you. So a few people have asked, can you get the ESG-MAX if you've already had a regular ESG?
That's a great question. So if you've already had the suturing portion of this procedure, the real question would be, can you get the fundus ablation? And the answer is yes. So you can have had the ESG in the past and then come back for a fundus ablation. And alternatively, we do offer the fundus ablation as well. And in the future, you could come back for an ESG. We have, found that patients tend to do the best if they have both done at the same time, but we can certainly do both.
All right, thank you. And Laura, we have a nutrition question. Someone asked about vitamins, if there's any vitamins patients should avoid before this procedure.
Nothing really to avoid. We can evaluate that with your dietitian at the time that we talk with you before your procedure, but there are no known vitamins or supplements that you need to avoid prior to the procedure.
Or are the vitamin requirements different after this procedure compared to a regular ESG?
No. You might need to keep an eye on your B12 levels just because that's where it's absorbed up there in the fundus. But other than that, just keeping an eye on that. And then if it is low, we can supplement that very easily.
Okay, Dr. McGowan, can you talk about suture failure? About how likely is that? What would happen if, sutures break? If you're, would you go to like an ER? Would you come to the clinic?
Interesting. Okay. So I guess there's a couple ways to look at this. The sutures that we place, they're not just going to break. I think that's something to just be very clear about. And they're tightly cinched together, so the stomach's held in place. That's really the main purpose of the sutures. We always emphasize this when we talk to our patients. We call them kind of the scaffolding that is holding that sleeve together to heal. Once everything heals, it stiffens into that sleeve-like shape. And then the sutures really are pretty much irrelevant. And so there's no need to really think about the sutures. They just kind of heal into that stomach wall, and then the stomach will remain stiff into a sleeve-like shape. Let's say early on something were to happen to a suture if you're concerned about risk. Well, this is very different than a surgical sleeve. You could imagine with a surgical sleeve, there's a stapled off stomach. Something happened to a stapled area, that's a hole that is communicating between the stomach and outside the stomach. That's an emergency. With ESG, the way that we're just folding and stitching the stomach together, if something, and this would be unlikely, but if something were to happen to a suture very early on, that area of the stomach would just kind of open up a little bit, kind of unfold slightly. Not dangerous, so that's a big difference. But more importantly, long-term, the sutures really aren't important. And so even when we do an endoscopy, after a year to two after an ESG, you'll see suture material. It's done its job. And so it's frankly irrelevant. We could cut it out. The sleeve would still stay the same. So they're just there to hold things together.
All right, thank you. Okay, Dr. Maselli, patient asked, would this procedure work with patients who have hypothyroidism?
Yeah, yes, absolutely. In fact, many of our patients come in with really common, as I mentioned, weight-related conditions, as well as just conditions that affect the general population. And hypothyroidism has to be within the top 5 conditions that we see in patients coming in for ESG or ESG-MAX. Now, sometimes dosing of thyroid replacement medication, is weight-based. And so you may need thyroid supplement adjustment with whichever physician is prescribing that to you over time as you enjoy the weight loss from these procedures. But it's absolutely okay to have hypothyroidism and an ESG-MAX.
Okay, Dr. Donnangelo, someone asked about physical restrictions after. It sounds like a new mom. They specifically asked if they'd be able to hold their baby after a procedure. So can you talk about that?
That's a really common question. Yes, hold the baby. So there are no activity restrictions whatsoever after these procedures. A lot of patients immediately think about abdominal surgery, where the abdominal muscles and abdominal wall they're cut. And so there are activity restrictions after a surgical sleeve or a gastric bypass. The stomach that we work on, it's so internal to your abdominal wall that there's nothing you can do in order to hurt that. So we actually encourage our patients to walk as much as possible, the day of their procedure. That helps with cramping, helps relieve, gas pressure from when we're insufflating. So absolutely no activity restrictions.
Right. Thank you. All right, Laura, I will send this one to you. Someone says, what would happen if patient who had this procedure continues to eat the same after their procedure as they did before? So just had the procedure, but did not change their nutrition.
So honestly, it would depend on how you ate before. If you ate smaller portions before and you're eating the exact same portions, then of course there's likely not to be a difference, but you are not going to be able to eat as much as you could before this procedure. Plus, you have this ghrelin, decreasing ghrelin, which is going to decrease your hunger. You're not going to have as much what I call food noise. You're not going to have this guy up here on your shoulder saying, hey, when are we going to eat again? So it's highly unlikely that you will eat the same amount. Honestly, that is where I'm going to go with that. But it doesn't change the digestion of food, if that's what they're asking.
All right, thank you. Okay, Dr. McGowan, a few people have asked about the price. What is the price difference in just a regular ESG and ESG-MAX?
Sure. So, and understand that price is kind of an evolving thing. It may change over time, but as at this point in time, in our program, a regular ESG is $11,000, just under $12,000, and the ESG-MAX, because of the additional equipment and time, adds $4,000 to that. This is still an all comprehensive program as well, so that includes everything: procedure, all of your visits, everything related to it. Our team, and for those who are interested in the procedure, our team would connect with you and talk about financing options that we have available. There's certainly many different paths to get to the ESG in terms of the financial side.
Okay, Dr. Maselli, a few people asked about BMI. What is the BMI range patients can have for this procedure?
Right. So it is really similar to what we see with traditional ESG. So ESG is an FDA-approved procedure, as Dr. McGowan went over, for BMI 30 to 50. But we have really good data that show us that going below a BMI of a 30 can be beneficial in that range that we call it, pre-obesity. So if your BMI is above 27, on a case-by-case basis, we'll entertain the idea of doing an ESG-MAX, particularly if there are coinciding, comorbidities like, high blood pressure, high cholesterol. Now, one of the limitations that we do have is equipment. And so the equipment that we need to perform the ESG-MAX safely is outside the hospital setting in our ambulatory surgical center. And what that means is that for patients whose BMI is much above 50, at the time being, right now, we're limited in offering the ESG-MAX to those patients just because of the restrictions on, which patients we can perform a procedure on in the ambulatory setting, the outpatient setting. But generally speaking, to summarize, if your BMI is north of 27 and below 50 or below, then you're a great candidate for ESG-MAX.
Okay. Dr. Donnangelo, someone asked, is this procedure helpful for someone with PCOS, and how so?
Really good question. So yes, with a 10% loss of total body weight, we see significant reduction in, and sometimes complete resolution of weight-related medical conditions such as PCOS, high blood pressure, diabetes. So yes, we, as we talked about our weight loss outcomes with these procedures, you would far exceed that, and you would see improvements there.
Right. Laura, someone asked about hair loss. Will they have to worry about hair loss after this procedure?
So when you hear about hair loss with bariatrics in general, it is due to several factors. You are eating very low calorie and your body prioritizes other areas of your body instead of your hair. Your hair is its least priority. It is scary to think about losing hair, but if you're following your protein recommendations, if you're taking a multivitamin, if you are losing slowly, like Dr. Maselli said earlier, you're less likely to see as much hair loss as you would with, honestly, a traditional bariatric surgery. There are ways to combat that nutritionally, depending on what you're eating and what your needs are. But with it also only lasts about, if you have weight loss related hair loss, it generally does start to stop at about 6 months post-op. So you'll see the hair growth return if that happens to you, but it's unlikely.
Okay, a few people asked about symptoms, since the GFMA portion is new. What are some reported side effects, and is GERD one of those symptoms or side effects?
Yeah, great. We didn't really directly talk about that in the presentation. I do want to also just stop for a second to say thank you all for your questions. There's a long list of questions that we have in front of us. We're doing our best to get through these. Keep pushing your questions through. We will get to as many as we possibly can. So I'll try to keep this concise. Symptoms. This is really interesting. You look at that ablated picture, you think that's going to hurt. Does not. So we learned that in our studies. Well, there's no nerve receptors in the inner lining of the stomach. So patients don't really feel the ablation. In fact, the ablation when performed by itself is a very, very mild procedure, usually just some mild cramping, maybe a little bit of nausea, maybe a little bit of pressure or nothing. That's just the ablation. So patients after an ESG-MAX, the symptoms are driven, and Dr. Maselli touched on this a little bit, but they're driven really by the suturing. And so the symptoms would be a lot of cramping for the first day, pressure, gas pressure, some nausea, lasting a day to 3 days. That's a typical recovery for an ESG, and it's almost identical for an ESG-MAX, aside from a little extra gas in the beginning. In terms of acid reflux, we haven't seen it with the ESG-MAX. It's a great question because you can see the changes to the top of the stomach. You might think that's going to lead to more reflux. Haven't seen it. It's something we're actively looking at in all of our clinical studies and registries. And if anything, we've seen a decrease in reflux in those who have it at baseline, which is really promising.
Okay. Let's see. There's so many good ones. Let's see, Dr. Maselli, someone just asked, will this procedure cure or help with sleep apnea?
Yes, yeah, it will. So that magical threshold, 10 to 15%, is what we see with sleep apnea improvement, and the ESG-MAX pretty consistently gets above that within the first 6 to 12 months. So yeah, sleep apnea would be one of the things to check off the list.
All right, Dr. Donnangelo, somebody asked, from the ESG-MAX procedures that we have already done, were there any patients or percentage of patients who did not see benefits from the ablation? Like lack or decrease in food noise, things like that.
Yeah, we have not seen anyone not benefit from the ablation. We've had rave reviews from the ablation. Patients are really feeling a huge reduction in their hunger and their cravings and that food noise. And it has just seemed to be a really remarkable addition to the standard ESG. So I would say, I don't know if anyone, has had any other experiences. I don't think so, but yeah, rave reviews for the ablation portion. It seems like it's helped everyone.
Yeah, and one thing we wouldn't know is what that patient's experience would be if they didn't have the ablation. So, everyone's going to have a slightly different response, but it's very obvious that there's a significant reduction in hunger. But what many of our patients will describe, I think we had one of those quotes, is that they are hungry when they're supposed to be. We can't completely obliterate hunger, which would be dangerous. So it's an appropriate hunger. And that's a really important way to look at this.
Okay, Laura, someone asked, is there a long-term eating plan after the first 7 weeks of diet progression?
Absolutely. We will definitely be here to help you with that. We get you through the diet progression. We're going to see you before your procedure. We're going to see you shortly after your procedure during that diet progression from the liquids, purees, soft foods back to your regular diet. We're going to see you right before you get to regular diet, make sure everything's going smoothly. And at that point, we do give you a personalized plan and find different ways to help you reach your goals. We use different counseling techniques as well. So you will be meeting with your dietitian to make sure that you're staying on plan.
Okay, Dr. McGowan, someone had a question about the ESG, but it applies to ESG-MAX. Why would someone come to TrueU? So why would a TrueU ESG be different than an ESG performed by someone else?
Okay. I think this is probably coming from the graph where we showed like a general ESG and then the TrueU ESG weight loss was higher. There's a couple reasons for that. And we've published our data. We know that our average weight loss with ESG is higher than the worldwide average. There's two main reasons. One is technique. This is not a cookie cutter procedure. It really does depend on the provider doing it and the skill level and the experience and the training and all of those factors. So procedure matters. And all of that support matters, probably even more. So Laura's team, our dietitians, all of the follow-up that we're providing really makes a big difference. And so when you combine those two together, you see greater weight loss. So that's why we know our numbers are higher. We're certainly proud of that. And it's why anyone looking for an ESG procedure, just a regular ESG, really should consider an expert center. Of course, the ESG-MAX is a little different because that's unique to us, but just as far as ESG in general, those are the key factors.
All right. Thank you. All right, Dr. Maselli, would Barrett's esophagus pose a problem for a patient wanting to have the ESG-MAX?
Yeah. So short answer, no. Slightly longer answer is that that's usually a consequence of chronic acid reflux, which, as we've alluded to here, might just get better. Certainly doesn't appear to be getting worse in the wake of an ESG-MAX procedure. Now, say someone has some pretty advanced Barrett's esophagus, it's nodular, or they have to undergo procedures to have it treated or removed, we probably wouldn't have ESG-MAX performed in and around those treatment sessions because there can be downstream effects of those treatments. But for someone who has Barrett's esophagus under routine surveillance, yeah, no issue, you couldn't get an ESG-MAX procedure. And again, I'd suspect that it helps reduce your risk by helping reduce obesity and heartburn, which are two risk factors for Barrett's.
Okay. Dr. Donnangelo, can you talk about kind of the logistics of patients out of state? Some people ask, can they have a procedure if they live out of state? When would they go home? Would they have to come back for any follow-ups?
Absolutely. So we have, first off, plenty of patients who come to us from out of state, even outside of the country. We have two centers. One is located in Atlanta, Georgia. The other is located in Cary, North Carolina. And so if you're coming from out of state, our team at whatever center you're going to will work with you to help direct you towards a hotel to stay at, transportation. We make everything really easy at both of our centers if you're coming in from out of state. As far as the in-person follow-up, exactly as I mentioned previously, obviously we need to have you with us on procedure day, and then we see you the following day in hydration clinic because we want to do a physical exam and check on your symptoms. And then all of your follow-up from that point on is all virtual, so you're able to go back home at that point. A common question that we get from folks who are traveling, especially flying or even driving in a car, worried about bumps in the road. There are no, activity restrictions. Patients, go home via car, they go home via plane, completely fine either way.
Okay, thank you. Laura, I'm going to try field for more nutrition questions, but I'm going to skip to Dr. McGowan. A few people asked about insurance. It's not covered by insurance, but are there any steps being taken to see if this procedure can qualify for insurance in the future?
Yeah, I mean, that would be certainly great for patients in need of this type of procedure. So it's a long path to insurance coverage. The ESG itself is moving along that pathway, not yet covered by insurance, but we're getting closer. We think that insurance coverage may be in place within the next couple of years for the regular ESG. ESG-MAX would be a later step because it is a newer addition.
Okay, thank you. And Dr. Maselli, someone said, what about the rebound, or what about rebound effect? I know people who've had gastric bypass and lost weight, but the weight started to come back a few years later. Do you have any stats for this?
Sure. So terrific observation. The weight, we use the word weight recurrence, regain, has a bunch of different names, is sort of part and parcel of a condition of obesity that we know is a chronic and progressive disorder. So it's something we stay vigilant for. Now, the ESG-MAX is a new enough procedure that we're just, now having our 1-year weight loss outcome. So we haven't seen weight recurrence in that large cohort of patients, but we recognize that, that's still an early time point as far as obesity treatments go. So we're not going to, pretend that ESG-MAX is immune from weight recurrence trajectories. If something as effective as Roux-en-Y gastric bypass can have it, then certainly those undergoing ESG-MAX, soberingly can experience it too. But we have some protective mechanisms in place compared to sort of standard endobariatric therapies. Unlike a balloon, it's a permanent change to the stomach. Unlike standard ESG, we don't have that ghrelin rebounding up from that weight loss. So there are protective mechanisms in place. And nothing, frankly, is more protective than the dietitian you see in front of you, Laura, whose team is going to be there for support and guidance and accountability. And again, that constant vigilance for, change in weight loss plateaus that would require intervention. Oh, Mary, I think you're muted.
Thank you. That helped. Okay, Dr. Donnangelo, someone asked, will this procedure work if you are in menopause?
Yes, the procedure will still work with your menopause, so it works the exact same way. There are, other considerations in menopause, like making sure you're maintaining your lean muscle mass as you're losing weight, that we will work with you on and your medical team will work with you on. But as far as the mechanisms of how this procedure works and the impact on hormone levels, as far as ghrelin goes, it's all the same.
Awesome. Okay, Laura, a question just came in. Someone asked about if reasons for overeating are psychological, what type of support do you supply? And if emotional eating continues, will the stomach be stretched out again?
I'll leave the second question to the docs, but as far as working on emotional eating or overeating, we will address that through nutrition counseling. And if you need further assistance with that, we can refer you to mental health care as well, psychological mental health care.
Yeah, as far as stretching out the stomach, really we want to use this tool to really set your habits for the long term, establish portion size. It's almost a fun adventure in the first few months when we're working with our patients, because you're relearning what your proper portions are, and you might overstep occasionally and say, okay, that was a little too much. That gets to an earlier question about what if you overeat. You'll feel it, you'll know right away. And then you say, okay, I'm going to dial that back a little bit. So over the course of several months, you'll learn what your portions should be, and then you'll just continue with that long term. That's the best way to long-term success.
Okay, Dr. McGowan, I'll give you another one. Would a hiatal hernia stop the procedure?
Thanks. Yeah, hiatal hernia. Yeah, it's not a contraindication to this. We've actually treated many patients now with hiatal hernias. It's perfectly safe. Hiatal hernia being a hernia at the upper part of the stomach, typically associated with acid reflux. So not a contraindication. It is safe.
Okay, thank you. Dr. Maselli, someone asked what the success rate of patients who have had the ESG and then come back and have the ESG-MAX is. I think that would be the fundus ablation, but.
Right. So there's essentially two options for a patient who's looking for a revision after ESG. They could have the fundus ablation alone, or if they felt like their ESG construct had really dilated, that sleeve had dilated out, they actually could have the ESG-MAX as the revisional tool, meaning the fundus ablation plus re-suturing the ESG. Now, in terms of the outcomes for this, we're still in the very early experience. So I can't give you exact numbers now in terms of the weight loss, other than anecdotally, patients have told us that their hunger is far suppressed after the ablation. Now, importantly, we have a registry So any patient who's getting an ablation-related procedure with us, be it ESG-MAX, fundus ablation, and any of those after an ESG, are given the opportunity to have their outcomes reported in this registry so that we can answer really great questions like that at a future date when we have those data.
Okay. Dr. Donnangelo, a few people asked if they had a gastric bypass years ago, would they be a candidate for ESG-MAX?
Unfortunately, no. The gastric bypass surgery completely changes your anatomy, so it's not suitable for an ESG-MAX procedure. We do have a procedure called a transoral outlet reduction, or a TOR, in which we can actually go down to the outlet, or the part of the stomach that opens into your small bowel. It's usually cinched down pretty tiny when you have your initial surgery, and it can dilate over time, and that can lead to weight regain. And so we can actually go and tighten that back down. But that's an entirely separate procedure called the gastric bypass revision, or the TOR procedure, transoral outlet reduction. So you can certainly see us for that too.
All right. Laura, someone asked, is there a local support group for patients to get together and talk or share recipes? I know we have one.
I wish we had a live local group that we could all get together, but our practice is a virtual practice for follow-up and support. And we do want to possibly address that in the future.
Okay, Dr. McGowan, someone asked, how does this procedure affect your metabolic set point?
Interesting. Well, weight loss in general. Well, that's a complicated question. Your metabolic set point. There's a lot of factors that play into that. Typically, as you're losing weight, your metabolism will decrease. So that's due to a few reasons. You're losing some lean muscle, some muscle mass along the way. You're losing overall weight, so you're just kind of burning less calories. But we want to really counteract that. So this is why we're working closely with you, so that we're immediately getting active. It's one of the advantages of these types of procedures. You can get right back into activity right away. You can start exercising typically within a week to two for sure. And so we want to lose zero muscle if possible. Just lose the fat mass, not the lean muscle mass. So we want you exercising when you're able and ready and interested. We want you doing resistance training if possible. And we're going to maximize protein when working with the nutrition team. All of those things will help to keep your metabolism high. And then we can counteract that decreasing metabolic rate that will occur.
Okay, thank you. Let's see. Sorry, I was on a nutrition question. Dr. Maselli, someone asked, is there any increased risk of stomach cancer?
This is one that we get quite a bit. No is the short answer. I'll give a little bit more explanation to that. So stomach cancer is a really, really rare cancer, but its risk is actually increased by obesity. It's actually one of the 13 weight-related malignancies in the human body. So if anything, we would suspect that stomach cancer risk would actually decrease from an ESG-MAX. Now, patient has concerns about stomach cancer and could it be diagnosed after an ESG-MAX if they were in that really, really, really unlucky small cohort of patients who develop stomach cancer. The answer is yes. So all the same modalities that we can use to diagnose stomach cancer, endoscopy, endoscopic ultrasound, CT scan, MRIs, those kind of things, can all be performed safely, effectively, very feasibly after an ESG-MAX procedure.
Right, thank you. Okay, Dr. Donnangelo, someone asked if patients typically have trouble with loose skin since the weight loss is slower than traditional bariatric procedures.
We get that question really frequently. So with any significant amount of weight loss, there is always a possibility of having some loose skin. So we can't say, you're never going to develop loose skin. That being said, the weight loss, as Dr. Maselli mentioned earlier, is much more gradual and attenuated. Typically, our averages are over the course of a year. And so we're working with you on resistance training and kind of coaching you through with your medical team to maintain muscle mass, and that weight is coming off slower. So patients tend to tell us that it's much less pronounced if that were to happen with endobariatric procedures as compared to bariatric surgeries. So possible, but much less in general.
Okay. All right. We have time for a few more questions, I think. Laura, a few people asked if they can drink caffeine or carbonation after the procedure.
So you can have caffeine and carbonation after the procedure. Would you want to? Probably not, especially for carbonation. We do ask you to restrict your caffeine intake just after the procedure for a couple of weeks, just to make sure we're not irritating that stomach. But as far as carbonation, the gas bubbles, when they get warm, they expand and it can make you extremely uncomfortable. And eventually you could drink those, but if they are sugar sweetened beverages, that's going against your weight loss goals. So that might not be the best idea to return to that. It can be a slippery slope back to a habit of drinking sugar sweetened beverages, but it's for a comfort factor if you avoid carbonated beverages and caffeine for a very short time.
Okay. All right, thank you. Dr. McGowan, a lot of people asked about what would happen to the ablated part of the stomach after the procedure. Does the
Okay. Probably the healing process. By the way, we are coming up on the hour. We still have something like 50 questions that haven't been answered. So we're not going to get to all of those. We will answer those later on tomorrow and at other times. But let's maybe take one more lap around the panel. So just to answer that question, here's what happens. So you saw what the stomach lining looked like in those pictures. That inner lining will kind of shed, just like almost like a scab falling off, and then it will heal. And so that healing does take time. It actually takes 6 to 8 weeks to fully heal. That's why we put our patients on medication to protect that inner lining, and that will then heal up and it will look pristine once it's fully healed. So that is the healing process. It's critically important to take those medications so that we don't have any problems along the way. And then interestingly, that 6 to 8 week timeline of healing corresponds with the decrease in the hunger hormone and the decrease in capacity. So it's a little bit of a delayed effect after the ablation.
Okay, so one more go around. Dr. Maselli, someone asked, will this procedure affect medication absorption?
This is a common question too. Fair question. So not really is the short answer to that. A lot of medications that we absorb may be broken down in the stomach, but we're really not affecting acid levels that help break down things in the stomach. But most medications are going to be absorbed farther south in the small intestine. So no, we really wouldn't expect this to affect medications. However, if you're on medications that are really important to have a really specific level of, like let's say immunosuppression, then it's a good idea to have that monitored after a procedure like ESG-MAX. But for your run-of-the-mill garden variety everyday medications that most of our patients are on, they do just fine after ESG or ESG-MAX.
Awesome. Okay. Let's see. Dr. Donnangelo, someone else asked, is it safe to do a colonic cleanse prior to having the ESG-MAX?
Is it safe to do a colonic cleanse? It is safe to do a colonic cleanse. I'm not exactly sure what that question means. There are, like a bowel prep or taking Miralax or anything, that's totally fine. That's safe.
Not something we recommend.
Yeah, exactly. That's what I'm
If you want to come in extra clean, we're not opposed to it, but not necessary.
Yeah. Thanks, Dr. McGowan. That's what I was getting at there.
Okay. Yeah, I don't know if that's like a most frequently asked question for the last one, but for Laura, this last question, I think it would be for you. If not, we'll send it to a doctor. Someone asked about, oh, sorry. They asked if there would be any, sorry, I lost the question, about vitamin deficiencies, if this would cause any vitamin deficiencies post-procedure.
We do not believe that this affects any kind of deficiency or would cause any kind of deficiencies other than if you were not eating a well-balanced diet, which you're going to be working with a dietitian. They can help you get to that point. Worst case scenario, you would just require an over-the-counter multivitamin, regular old 1-a-day multivitamin for most people if they need it.
All right. Thank you. That is the hour. Thank you all for joining us. Just one last word. We've covered a lot of territory. If you want to meet with one of us and talk further about your own specific situation and whether this could be a good tool for you, reach out to us. You can hop onto our website at True You Weight Loss and contact us and have a discussion. Otherwise, as I mentioned, a lot of questions still outstanding. So we are going to address those in the coming days, coming weeks. You'll see a lot more about ESG as we continue this conversation. But we hope you all have a great evening. And thanks again. Really appreciate you joining us.